Good. Okay, so I believe we're recording.
All right. Thank you, everyone, for joining us for this next installment of the Inner Source Health webinar series. This is Dr. Robert Kochko. I'm one of the naturopathic doctors and acupuncturists at Inner Source Health, and I have the great fortune of introducing Dr. Peter Bongiorno for a talk that, very honestly, is probably the most asked about talk that I've gotten in the last 12 or 18 months. Everyone wants to know about CBD. You've seen it on every store shelf these days. All products are not created equal. And then the question that we always get is really, I guess, two questions. First of all, does it work? Does it do anything? And then secondarily, what's the best source? Does it matter where you're sourcing it from? And so Dr. Peter certainly over the last couple of years has done tons of research on this topic. I know we've spoken about it personally. He's actually taught our practitioners at our clinic. And so this talk is really geared for you to be able to learn and to be able to debunk the difference between hope and hype when it comes to CBD. And so without further ado, Dr. Peter Bongiorno, I don't know if you wanted to skip the slide forward. I can introduce you a little bit.
Yeah, thank you.
It's always a little awkward to introduce yourself. So of course, we've got a little bit of a disclaimer here pointing out that this really is intended for educational purposes. It's not healthcare advice. It's not medical advice. And assuming you're not, recording this webinar, but when you're listening to it, just know that it's intended just for the purposes of education and is only to be used by Dr. Bongiorno or Inner Source Health and its representatives. All right, so there's Dr. Peter playing the drums. Amongst all those other things, he's also a prolific drummer. I think he's not doing it as much in his life as he would hope for these days, but maybe that's coming next in the journey. So I've known Dr. Peter for, probably 6 or 7 years now at this point. I've definitely learned a lot from him, and I know his education and learning started way back through some personal experiences, but also at the National Institutes of Health. He was working for the Department of Clinical Neuroendocrinology, doing some research out there before he went out to Bastyr University, where he did earn his naturopathic doctorate and his master's in acupuncture. And they came all the way back here, Dr. Pina and Dr. Peter, to New York to start some practices, first in Staten Island, then in Manhattan, and in Huntington, Long Island, where we are now. He's got a bunch of accolades, from Physician of the Year from the NYANP to being a nationally recognized speaker. And he's written a couple of books that you've seen, some for providers, some for the general public, most often in mental health and anxiety, depression, things like that. And so I know Dr. Peter's personal mission is to help restore the mental health of really the world. I was going to say the United States, but I suppose the world, especially with your readership. I know we've got some books in Italian and all those languages. So without further ado, Dr. Peter Bongiorno, I see in 2018 he was trying to surf, so he's going to maybe tell you a little bit about that as well.
The little that I know about surfing, yes. Thank you so much, Dr. Robert Kochko. And for those of you who don't know Dr. Kochko, he is incoming president of the American Association of Naturopathic Physicians. So it is indeed an honor to have you introduce me. So definitely. Okay, so let's talk about CBD. Let's talk about why we have fun. So what's the reason to have fun? I put this picture of me playing the drums. It's one of the questions I ask patients when they come in for first visits sometimes is, what really makes you feel like your best self? What really makes you feel like you? and people have different answers. I know for me, it's music, and I love running and things like that. And I, probably for years, I never thought about why I liked music so much. But I just knew it always made me feel good, and I always loved to do it. I mean, it doesn't make any sense, right? Because why does hitting something and singing into a microphone make you feel good? But it does. And if you look at research, actually, this just came out in November of 2018, and they looked at endocannabinoid concentrations in mood following singing and following exercise in healthy volunteers. So endocannabinoids are basically the natural molecules your body makes to make you feel good. Endocannabinoids means that they're cannabinoids. They're these molecules. Endo means your body makes them yourself, and they go to your brain and they go to your body and they bind to these receptors, which we'll talk about in a bit, that help your body feel good. And it binds to the endocannabinoid system. And what they did in this study, and they looked at people who were singing and they looked at people who exercised, and they found indeed that these activities will increase your natural endocannabinoids. Singing, if you look at the second bullet there, increase the blood levels of a molecule called anandamide by 42%, and also positive mood in 9 volunteers. Small study, but significant results in the sense that anandamide is really one of the main molecules. Actually, the word ananda is Sanskrit for the word bliss. And it was named anandamide because what was found is that when people make this anandamide molecule, they generally just feel happier. So they found that running does this, that singing does this, and actually the activity that you like the best will do it the most. So, and that makes perfect sense. So the runner's high, you know, when we talk about the runner's high, we talk about endorphins, right? Oh, it raises your endorphins. Interestingly, that's probably not completely true because endorphins do go up, but they stay in the regular body. That BBB, it says it doesn't cross the BBB. That stands for blood-brain barrier, meaning these endorphin molecules actually don't get from your body into your brain to make you feel good. But anandamide actually does make you feel good. So it's pretty interesting stuff. Whoops, sorry. And okay, yep, so that's it. So really when we're talking about the runner's high or feeling good, doing something you love, we're really talking about the endocannabinoid system, cannabinoids going up in your body and anandamide getting into your brain and just making you feel wonderful. So, so our talk is going to look at the history in the endocannabinoid system in a little bit, how the endocannabinoid system works in our body, the best uses of CBD, cannabidiol, safety of CBD, quality of CBD products, and a little bit on dosing. So just very, very briefly, cannabidiol and cannabis has been used for millennia. It's probably one of the oldest medicinals used, up there with ashwagandha, up there with some of the Ayurvedic herbs. So cannabis has been known for millennia, thousands and thousands of years, to be helpful for a lot of different conditions, certainly for pain, certainly for mood. And it started really in Asia and went throughout the world to Europe, to Africa, to this country, certainly in North America. And really the reason why we haven't talked much about it in the last century, not to go into politics, is really because it's been suppressed and it's been held down. And there's a lot of conspiracy theories about that. A lot of people feel pharmaceutical companies are the reasons for that. A lot of it is because of stigma that was attached to marijuana. This talk really isn't about that. We can have a whole talk on that. but suffice it to say, this medicine has been held back from you for a very, very long time, including CBD. And only recently, a couple of years ago, Barack Obama had signed some legislation that kind of started the movement of hemp being used again in CBD. And then in November of 2018, I'm sorry, in October of 2018, President Trump signed some legislation called the Farm Bill, which really started the allowance of CBD products to be sold legally without companies having to worry about the legalities of it and getting raided by the FBI. So finally, we have the CBD here, and it's being used. And the research is starting to trickle in. It's been done for the past few decades here and there, and we're going to talk about some of it. And it really is something, I think, to think about and to look at. So how does the endocannabinoid system work in our body? So briefly, cannabis, the plant cannabis, there's there's two forms of it. One is marijuana, which, you know, we all, when we think about kids in college and wanting to smoke weed and getting high, we're thinking about marijuana. Marijuana has, we'll call two main cannabinoids. One is CBD, which this lecture is about, and the other is THC, which is a psychoactive compound. That is the one that really kind of makes you feel high. And marijuana has about 15 up to 40% by weight of THC. Now there's hemp, which is another cannabis plant, which has very, very low amounts of THC and usually under 0.3%. So far, far less. And so when we talk about using CBD oil, we're talking about using it from the hemp plant, which naturally has very, very low levels of THC and not enough to actually cause psychoactive issues. So, when you think about CBD, you don't want to think about using it to get high because it's not going to happen. There's not enough THC in there. Okay, and what does CBD work on? So CBD works on a few different systems of the body. It works on the digestive system, it works on the brain and the central nervous system, and as you see here, it works on the organs of the immune system. And it works specifically by stimulating cannabinoid receptors, either directly or indirectly. And the cannabinoid receptors, there's two main ones. There's actually a third cannabinoid receptor that's also been elucidated, but there's not a lot of research about that right now. So for our purposes, we're going to talk about two. CB1 receptors are mostly in the brain and central nervous system, and CB2 receptors are for the most part in the digestive system, immune system, and the rest of the body, although that's not entirely true either. But for the most part, that's correct, and that's how we can think about it. So what happens is our body, our endocannabinoid system, when it's healthy and it's working well, it makes a molecule called anandamide, which I mentioned before, and that's the one that goes up when you run, when you sing, when you do things you like to do, when you're with people you love. And what happens is this anandamide binds to the CB receptor, either cannabinoid 1 receptor or cannabinoid 2 receptor, and then it makes changes in the cell that creates effects. And these effects can be anti-inflammatory, they could be anti-anxiety, they can be sleep promoting, they could be relaxing, and they can also create good mood. So all of those things are part of what anandamide can do. CBD is actually a molecule that can also affect our body. So anandamide is what our body naturally makes. CBD comes from the plant, comes from hemp, and is basically a phytocannabinoid, right? It comes from plants that we can take in, and it can also have similar effects. Now, the way it works is actually by not allowing your own. So if you look at the left here, this is my favorite diagram. I know it's a little bit crazy, and you certainly don't have to memorize it. But what you see here on the left is that cannabidiol can actually affect an enzyme that breaks down anandamide and lower its ability to break it down. So when you take CBD, you end up keeping a lot more anandamide around, and it makes your mood better. So for people who are really stressed out, who have low endocannabinoid tone, which we'll talk about in a minute, it's a nice way to naturally keep your own levels of anandamide up. So it's a very natural way to do it. So cannabidiol doesn't actually bind too much to CB1 receptors, but it actually helps stop the breakdown of anandamide, and that's what binds to the CB1 receptor to help you feel better. It also does a few other things. Besides binding to receptors directly, it also helps promote serotonin receptor activation. Serotonin is a molecule that creates good mood. It binds to opioid receptors, which can also help mood. Of course, it's not as strong as opioid drugs or anything like that. It's much, much gentler and much more balancing. It can bind to glycine receptors. Glycine's important for calming as well. it binds to something called the vanilloid receptor, which doesn't make you taste vanilla. But what it does do is it can help pain and help lower inflammation in the body. And then it also can help stop adenosine. So adenosine, I'm sorry, it can help keep more adenosine around. So adenosine is important because it helps you get sleepy as the day goes on. As your body uses energy, it makes more adenosine. Adenosine can make you sleepy. So it can be calming and help you get sleepy. It also affects the genes in something called PPAR gamma activation, which is important for things like metabolism. People who have poor activation of PPARs end up with metabolic issues and cardiovascular issues, and sometimes even diabetes and blood sugar issues. It also affects this GPR55, which affects how the cells replicate themselves and can affect things like cancer. And mitochondria, it helps mitochondria activity and protection, which is important for energy. So what does it do? It helps produce calm in the body through those mechanisms. It helps produce less pain through those mechanisms. It helps produce better sleep through those mechanisms. It helps improve metabolism, and it also can help even prevent cancer. There's studies on this going on with CBD now, and it also can promote energy. So all of these things have actually good studies that back up these mechanisms. Okay. So in cannabis and in hemp, we have a lot of cannabinoids. We have also and the cannabinoids are things like CBD and THC, which we talked about, but there's a whole bunch of other ones too. There's also a lot of terpenes, things that come from other plants, like for example, linalool, right, is one of the main components in lavender that's very calming. Well, we also get it from cannabis and hemp as well. Beta-caryophyllene is very good to help lower inflammation and help with pain. Humulene, which come from oats, which can also be good for calming. And then there's also flavonoids, a bunch of flavonoids, quercetin, silymarin, which we also get in things like milk thistle, which is good for the liver. So when we think about taking CBD oil, we want to take something that's either full spectrum or broad spectrum, meaning that not only does it have CBD, but it also has all these other compounds, which we haven't even fully studied, but we know are probably really good for us too. At least that's what the research is supporting, and certainly things that we know we see in other plants, which we know are very healthy for us. So broad spectrum means that it has all of these compounds but no THC, and full spectrum means the CBD oil has all of these compounds and a little bit of THC under 0.3, so meaning that it won't be psychoactive. Let's see, next one. So what are the best uses of CBD? So based on everything we talked about, probably the top uses that are supported with very clear research are things like anxiety, depression, sleep issues, and as an anti-inflammatory. So it's great for pain, it's great for autoimmune issues, and it's good for joint issues. It's used topically as well as internally. I remember I went to a conference last year called A4M, and a medical doctor had developed this type of CBD cream that he was using on animals who had epilepsy and epileptic seizures. And he actually showed animals who couldn't walk and had these neurodegenerative problems and these seizures, he would put the CBD cream on their body and behind their neck, where the base of the brain is. And you could actually see in real time the animals calm down and act more normal. I was really very impressed with those films, seeing that. So, and these studies that we're seeing here show the same thing, that this molecule, the CBD, can be very effective in helping calm arthritis, helping calm anxiety, even useful for depression and for sleep. I also like to look at some genetics when I think about using CBD. One of the main genes you can look at is a gene called FAAH, which encodes for fatty acid amide hydroxylase, which helps you break down your anandamide. So certain people with certain forms of that gene probably will do better with some CBD because it can help aid them when maybe they're breaking down anandamide a little bit too fast. So, and there are actually other genes which I've been looking at and working on as well. So that's one of them, but there are a few others. Are we there with the research? No, I don't think we are. This study from 2019, which came out, suggests that there's still a bit of a way to go. And is CBD a miracle? No, I don't think it's a miracle. I don't think a person takes it and everything gets better, and terrible chronic anxiety for the past 2 decades just goes away, or all your pain goes away right away. But I do think when put together with a good, solid, holistic naturopathic plan, it can be very, very helpful. And I think there's plenty of research to show that. So endocannabinoid tone. So what lowers tone, right? Drugs, alcohol, nicotine, chronic stress, being overweight, taking in too many calories, and yes, too much THC. So people who smoke too much marijuana, it ends up lowering your endocannabinoid tone, which isn't good for your stress and inflammatory systems. And when I said drugs there, I meant both recreational drugs and pharmaceutical drugs. Because pharmaceutical drugs are very toxic, especially to the mitochondria, and should only be used when absolutely necessary in emergency and urgent care issues. What supports endocannabinoid tone? A good naturopathic regimen. Getting sleep, getting exercise, meditation, massage, eating the right food should be there as well. And then supplements. There are certain supplements that are already proven to also support endocannabinoid tone. Good fish oils, good probiotics, the right herbs and botanicals, especially the ones that are adrenal supportive, and of course CBD. Is CBD safe? Actually, it seems to be very, very safe. They've done studies. There was actually a children's study in an epilepsy research journal from 2019 of August, so just really a couple months ago. And what they showed was in these kids who unfortunately had epileptic seizures, they gave them 730 milligrams of CBD for the average 10-year-old. So that's about 23 milligrams per kilogram of body weight. And what they found is that they had great reductions in motor symptoms and very little to no side effects. And that was over a 12-week period. So this was CBD by itself. So it wasn't without the other components that we have in broad and full spectrum CBD, like the terpenes and the other cannabinoids and the flavonoids. And what's been shown in other studies is that when you use a broad or a full spectrum, you can actually use far lower doses of the CBD and get relatively good effects. And there's studies, there's a fellow named Michael Lewis who's done a lot of studies in patients with traumas and concussion, and in football players and military people that he's worked with down in DC. And he's shown that you don't even have to use those high doses to get some of the effects. And he also used a lot of fish oil with them as well. And what's the reason why it's so safe? Well, I have a picture of the brain here. And if you look at the brain, right, the brain, this part of the brain here, in the anterior and posterior base of the brain, there's respiratory centers. And most drugs, especially drugs that relieve pain and work on the nervous system, tend to suppress the respiratory centers. And if you suppress those centers enough, you can kill the person. Well, it turns out that there's no CB1 and no CB2 receptors in that part of the brain. So because of that, that's why you don't even hear, even with marijuana, people overdose and die from marijuana. Yes, you can get very sick. It can make you paranoid. It can create a lot of side effects. But I personally have never heard of someone overdose and die from marijuana. And that's the reason, because it won't suppress respiratory centers, even at high doses. So even though it is quite safe, there's a few things that we want to think about. Patients who take warfarin and anti-clotting drugs, what they call, anticoagulant drugs, blood thinning drugs. You want to be careful with them. People are taking anti-seizure medications only because it might augment the effect of the anti-seizure medication. It's also possible that if you're doing it carefully, you might even be able to give them together for a better effect and use less drugs. So that's something to think about. And if you are taking any medications, of course, don't stop taking any of your medications and start this. Talk to your doctor and work with someone who knows what they're doing with these. Theoretical potential for interactions with certain psychoactive drugs, antibiotics, and that's theoretically because of how we know CBD gets broken down by the liver. Is it safe with antidepressants? Well, theoretically, again, it might make serotonin reuptake inhibitors work longer. So we might have to lower the dose of the SSRI. And honestly, with patients, I see that. I see when patients get on cannabinoids and they're doing the holistic naturopathic things that we need to do for good health, generally, it looks like they can actually start to lower their serotonin reuptake inhibitors and not need them as much anymore. So again, that's not something you want to do on your own. You want to work with your doctor on that. And conception and pregnancy, there's very little information about conception and pregnancy. Again, theoretically, it's suggested that possibly it can affect the endocannabinoid tone of the baby in the womb, and that might not necessarily be a good thing. We just don't know, so I don't recommend it for those particular issues, particular situations. So the quality of CBD products, so that's my daughter. That's in Great Neck where I live, and that's a store, a market nearby, a very small market that sells a whole lot of different things, vegetables and cereals, and it has a hot food bar and tons of beverages and energy drinks and, what you would typically get from a little market near the train station, right? And it's also selling CBD, which they proudly put that big sign on the front door. Now, everybody is selling CBD, and everybody's brother is selling CBD, and their sister is selling CBD. It's very, very popular, so it's out there. And unfortunately, it's hard to tell. I mean, I don't know that this particular little market is known for its quality nutraceuticals, and I'm not really clear that the CBD they're selling is actually a quality nutraceutical either. Personally, I would probably, buy CBD from just very high quality individuals and companies that I know that's their mission and their goal is to make very, very high quality products. So, and because it's out there and it's in gummies and it's in brownies and it's in candy bars, it doesn't mean that's the best way to take it. So, so when we looked at quality of CBD, we want to ask a number of questions. Is it organic? Is it metal and solvent free? Is it CO2 extracted versus extracting it with solvents? Is it tested to make sure the THC is where they say it is? Because certain strains of cannabis might have higher levels of THC, and then that's a problem because you don't want to give people psychoactive medications unknowingly, right? Bioavailability, I think those numbers got a little messed up, but bioavailability, is it something that's going to get, when you take it in, is it going to get absorbed? And that usually has a lot to do with what's around it, what oils are around it, or what vehicles there are. Preservatives, are there preservatives in it? Is it non-GMO? Is it gluten-free? Is it hypoallergenic? Is every batch tested? A lot of companies, they'll test batches occasionally, but good companies test every batch. And are there terpene and cannabinoid analyses? And if you look, the companies that we use for our CBD have all of those analyses, and all those boxes are checked off, because I know if I'm going to take something, I need it to be the highest quality if I'm going to put it into my body. And that's what I would want for all my patients as well. So this is the CBD we use. I know there are a number of good ones out there. Certainly ours isn't the only one that's high quality, but I think it's one of probably a rarefied few in terms of percentage of CBD that's out there. We usually I like to dose around 25 milligrams, which for our tincture is half a dropper full. Sometimes people dose less, sometimes people dose more. Whether you dose it in the morning or the evening is going to depend on your particular case. But that's usually, I think, for an adult 120-pound or above person, a good place to start, about 25 milligrams of actual CBD. And then we also have gel caps, and the gel caps are also 25 milligrams per gel cap, and they use a special technology called Vesasorb, which actually helps increase absorption. And this is a broad spectrum, so it has 0 THC, and it also has a lot of extra beta-caryophyllene. It has an extra 10 milligrams of beta-caryophyllene, and beta-caryophyllene is one of the other cannabinoids that's very, very good for pain and for inflammation. So when I have patients who have more pain and inflammation and maybe some anxiety, I'll use the gel cap versus whether it's more of an anxiety and maybe sleep issue, I'll use the full spectrum liquid. Okay. Other endocannabinoid supports, as we said earlier, there's other supplements that can really help. I like to use probiotics. We use our Restoraflora. I like to use a high quality Omega. Also, the top two here, I formulated. One's Mood Systems Balance, which has herbs to kind of help balance your digestion, inflammation, and your stress system for people with both things like anxiety and depression. And the Neurotransmitter Balance I use a little more sparingly, and for people who have low mood, when we kind of want to help support their neurotransmitters so that their mood gets raised. I also give tryptophan, which can help serotonin when I suspect that that's low as well. Especially this time of year, I'm using a lot of tryptophan complete. As the sun goes down earlier and the angle changes, we're making less serotonin, and people tend to have more seasonal affective disorder. And then also melatonin. So serotonin becomes melatonin in the brain. So when you use melatonin, you can support that serotonin system directly and support the endocannabinoid system indirectly. So these are supplements that I generally will use when I'm also giving people cannabinoids like CBD. So just as a reminder, if I had to pick one slide, which I thought was the most important, it's really about endocannabinoid tone, remembering what lowers the tone, the drugs, the alcohol, nicotine, chronic stress, eating too much, and also too much marijuana. And then what increases your tone, all good naturopathic recommendations: sleep, exercise, massage, healthy foods, and then the right supplements. And, you know, and I tell people, when I work with my patients, it's not all about the supplements. I know we talked about CBDs and I showed you some products, and they're great. But if we're not doing the basics, if we're not sleeping, if we're not exercising, if we're not relaxing, doing the things we love, eating good quality food, in my opinion, the supplements by themselves won't get the job done. But if we do it all together, we can get amazing results. And that's why we're here. What did Hippocrates do a long time ago? The father of medicine, he gave people healthy food. He wanted them in the sun. He wanted them exercising. He had them use hot and cold hydrotherapy baths to stimulate their endorphins, right? And he also gave them herbs, right? So in a way, what Hippocrates did years ago and what I recommend today is kind of the same thing, right? It's really not much different. We might have more studies and more specifics, but really the recommendations that the father of medicine gave us, I think, still really hold up today. So these are the wonderful people I work with at InnerSource Health: Lindsay, myself, Dr. Pina, Dr. Victoria, Dr. Don, and Dr. Rob. So I really value working with them. I learned so much from them. They're doing lectures as well and webinars, so please check our schedule for their webinars too. And this is my contact information. These are the books that I've written on the subject of anxiety and depression. And please do join me on Facebook and Twitter. And I'm always posting information and research. I'm really excited about this. I'm excited to hear what you have to say about it too. So thank you so much. And if we have any questions, I'd be happy to take them as well.
Yeah, we do have a couple of questions that have come in, and I urge anyone seeing Dr. Peter's information on there, you can email info@InnerSourceHealth. If you have any follow-up questions, whether you're listening live or if you're listening to this as a recording, days or weeks or months later, we're always happy to help you. We have time for just about 2 quick questions, so I'll just take them in the order that they came in. The first was around, you mentioned this idea that smoking marijuana can lower CBD tone, right? And taking
Mhm.
CBD can increase it. What's your recommendation? It seems like this person is sort of asking for a friend. What is
Uh-huh.
your recommendation around it? If people smoke a lot of marijuana, how should they be approaching taking something like CBD in a
Yeah.
product?
It's interesting because the first studies on CBD were for people who were overdosing on THC, and they were trying to figure out how to counter it a little bit and help people get off it. Because it's anything starts to get a bit addictive if you take too much of it. So the very first studies looking at CBD and its effect on the body were looking at people who were taking in too much THC. So really, trying to increase the CBD to THC ratio is a great idea, and you can start that by taking more CBD. But at the same time, if there's an issue with smoking marijuana and maybe taking in too much, I would want to dive into that and see, well, what are the reasons for that? Usually it's because people are really stressed out and anxious and they're trying to kind of get away from how they're feeling for a while. So I would want to look into that. And then as the person increases CBD intake, then you also want to start maybe using different strains of marijuana that have lower THC levels. I mean, one of the, I think, problems with marijuana intake these days is they're constantly developing higher and higher levels of THC to CBD because everybody wants this psychoactive high. And I think that's becoming problematic because years ago, all the marijuana was much lower THC to CBD ratios. And so it was a lot more balancing. And now I think it's becoming out of balance. And I also want to just also mention that, the studies are pretty clear that under 26 years of age, our brain, our endocannabinoid tone, and our nervous system haven't really fully developed. And taking in marijuana probably isn't a great idea. And even though in the states where it's legal at 18 and 21, I believe that really people should wait till a bit later in life if they're going to start using CBD, marijuana at any level. So that's my personal opinion based on the research.
Great, thank you. That was very thorough. And so our second and last question is specific to inflammatory bowel conditions and most specifically ulcerative colitis.
Mhm.
What's your take on the research and the utility of something like CBD for someone who's dealing with that?
Yeah, well, so CBD has been shown to be a good anti-inflammatory in the gut. Again, whether by itself is going to cure something like inflammatory bowel disorder, IBD, whether it's also colitis or Crohn's, is usually a result of a few things. Usually there's a stress component, there's always a food sensitivity component. Oftentimes people aren't sleeping and so the gut can't repair. Usually the flora of the digestive tract is very unbalanced. So, and usually there's short chain fatty acid production in their intestines, which is very important for keeping and maintaining good bowel health, is also very low. So when I think about inflammatory bowel disorders like that, I want to work on all of those things together. But CBD can be useful for the inflammation and can be useful for calming the brain. And when you calm the brain and it becomes less stressed out, then the intestines can start working better. So if you get the foods better, you get a person sleeping, get them calm, maybe a little CBD, a little bit of butyrate, maybe some herbs that help heal, whether it's berberines, maybe vitamin A, which is good for the lining, vitamin D. You put all those things together, then you can kind of create a plan where healing can take place.
Yeah, I think I would agree. Just based on my review of the research over the last couple of years, it seems like certainly in animal studies, we have anti-inflammatory effects that are very clear. And then in human trials, we have symptomatic improvement. But whether, I think the last Cochrane review was in like 2018
Mhm.
for IBD, colitis, and CBD. it doesn't look like we have the smoking gun study that says, yes, CBD is the only thing that
Yeah.
can, that you can take as a solo monotherapy to cure colitis or to put someone into remission. However, I think much to your point, that's very much because you have to do all those other things. It's not just one aspect, but as an anti-inflammatory and maybe as a symptom reliever, there is some really interesting research.
Yep. Yeah, absolutely.
Great. Thank you so much for that. Well, I do see another couple questions. So what I'll do is I see your names. I'll have Dr. Peter maybe reach out to you. And certainly, like I said, reach out to us through social media, through Facebook, InnerSources Facebook, through our emails. We're always here for you. We're always happy to help. Thank you once again, Dr. Peter Bongiorno. This was super informative in a very short amount of time. And so that was it's always an impressive feat.
Oh,
So.
this was a pleasure. Thank you, everyone listening. I know your time is very valuable, so we really want your time to be well used when you listen to these webinars. So thank you so much.
Great. All right, everyone. Have a nice day.